So today we're going to be talking about the process of getting an IBS diagnosis. And to do this, we're going to break it down into 4 steps, including step 1, consulting your physician, step 2, providing a detailed history, step 3, a physical examination, and then step 4, limited tests as needed. And then finally, we're also going to talk a little bit about the base criteria for getting an IBS diagnosis called the Rome IV Criteria, which come to us from an organization called the Rome Foundation. And that's because IBS is diagnosed based off of symptoms as opposed to tests. So it's important to know what the symptom criteria are to have an IBS diagnosis. So the first and most important step in the whole IBS diagnosis process is that you have to consult with your physician. Now, I'm not going to expound too much on this point because I feel like the reasons for this will be obvious as we progress throughout this video. But if you're having suspicious GI symptoms and you think it may be IBS, definitely pause and set up an appointment with your physician because you're not going to know until you have met with your provider. Now, on to step 2, which is that you have to provide a detailed medical history to your physician about the symptoms that you've been experiencing. And when I say detailed, I mean detailed. So some of the questions that your physician will probably be asking you will be related to the criteria that you have to meet to have an IBS diagnosis. So they're going to need to know things about the frequency, onset, and duration of your symptoms. They're also going to need to know if you have the experience of abdominal pain as part of your GI symptoms. And also they'll need to know if you're having any sort of altered bowel habit experience. And an altered bowel habit experience can range from there being abdominal pain related to defecation or pain that is associated with changes in stool form. So they may even take out this chart called a Bristol stool form scale that has 7 or so different images of stool to ask you, which type of stool are you predominantly experiencing when you're having abnormal bowel movements? And they might also ask you things about the frequency in which you're having bowel movements as well. Now, I know this probably sounds like a lot of uncomfortable questions about your primary bowel habits, but it is for good reason. And that is because if you do get an IBS diagnosis, the next step your physician would take would be to give you an IBS subtype. We talk about subtypes in some of our other videos, which I'll be sure to link down below. But basically, your primary bowel habit determines the subtype that you are given and also plays a really big role in the most appropriate treatments for your IBS symptoms. Now, aside from asking you about those core IBS symptom features, your physician's also probably going to want to know if you've been facing any sort of mental health challenges such as anxiety, depression, or any other psychosocial challenges or stressors that could potentially be worsening your GI symptoms. Now, your physician and hopefully also a registered dietitian may also ask you some questions about your routine dietary intake to see if maybe there's something in the diet that could possibly be provoking GI symptoms, or that could be pointing towards there being another condition, for instance, like lactose intolerance, that could be provoking IBS-like symptoms. There are also several prescription over-the-counter medications or supplements that can impact GI symptoms. So another thing that your physician will be asking you about will be any medications that you're taking or any supplements. Your physician will probably also ask you about any prior medical procedures or tests that you've had done. So things like, whether or not you've been screened for celiac disease, or if you've ever had some kind of intestinal surgery, like bariatric surgery, for instance. These would all be relevant details that your physician would need to know. Your physician will probably also ask you about any alarm features that you may be experiencing that could be indicators for another condition that is not IBS, but that can have overlapping IBS-like symptoms. We've done a video where we talk about different alarm symptoms elsewhere, which I'll be sure to link down below. But things they might ask you about could be features like unintentional weight loss, family history of colorectal cancer, celiac disease, or inflammatory bowel disease, rectal bleeding. These are just a few examples, but if you want to know more, then definitely check out that video that I mentioned. Your physician may also ask you for some supporting information about whether or not you've had a gastrointestinal infection prior to developing these symptoms, or they may ask you questions about your early childhood or if you've experienced any sort of traumatic events throughout life. And that's because we know that these are some factors that can be associated with the onset of IBS.
Before we continue, I want to quickly tell you about ibsprobiotics.org. So this started out as a research project, but then we ended up turning it into this really cool comparison tool. When you go on the site, you can easily compare which probiotics were most effective for different IBS symptoms, all exclusively based off of clinical studies. In fact, we spent the past 2 years building it, having analyzed over 50 different probiotics across more than 75 placebo-controlled trials. And the results surprised us. For example, we found that some really popular probiotics were nowhere near as effective as some lesser known options, and there were even some probiotics that seemed to do more harm than good. So I hope this free tool helps you to cut through the marketing hype and saves you a ton of time when evaluating a probiotic.
And now on to step 3, which is that your physician is going to conduct a thorough physical examination. And the purpose of this is just to screen for any findings that may warrant additional medical tests, while also minimizing the risk of ordering tests that may not be necessary. The physical exam can include things like your physician checking for abdominal tenderness or distension, also any sort of palpable masses. And it may also involve a digital anorectal exam. Now, if you're anything like me, the term digital anorectal exam probably gave you pause. So just to clarify, yes, that does mean that your physician may insert a finger into the rectum. And I promise there is a reason for this. This could be done to check for things like hemorrhoids or anal fissures, especially if you've been experiencing blood in the stool, for instance. This can also be done to check for any sort of weakness in anal muscles that may be predisposing you to things like fecal incontinence. And it's also used to check for different muscle contraction patterns that could be causing issues with defecation. Now on to step 4, which is that your physician may order limited amounts of testing as needed. Now, I want to make it very clear that there is no test to diagnose IBS. IBS is diagnosed based off of meeting certain symptom criteria. So testing is not so much to help diagnose IBS, more so than it's used to rule out other conditions that could be presenting with IBS-like features. Now, many falsely believe that IBS is a diagnosis of exclusion, meaning that you should have extensive testing to rule out so many other conditions before finally arriving on an IBS diagnosis, but that's not true. And we also know that this increases healthcare costs, doesn't improve treatment outcomes, or anything related to patient satisfaction. So know that when your physician is ordering tests, it will only be when there is high clinical suspicion that something else could potentially be going on, not because they need to rule out everything under the sun in order to give you an IBS diagnosis. And then finally, as I was mentioning before, IBS is diagnosed based off of you meeting certain symptom criteria. So the symptom criteria that you will have to meet in order for your physician to arrive at an IBS diagnosis comes from an organization called the Rome Foundation, and the current criteria are called the Rome IV Criteria. So in order to have an IBS diagnosis, you have to have recurrent abdominal pain on average at least 1 day per week in the last 3 months, associated with 2 or more of the following criteria: related to defecation, associated with a change in frequency of stool, associated with a change in form or appearance of stool. And then this criteria has to be fulfilled for the last 3 months with symptom onset at least 6 months prior to getting an IBS diagnosis. And that's all I'm going to be sharing today about getting a diagnosis with IBS. But one quick reminder about those resources that I was mentioning earlier that are linked in the description box below. Be sure to check those out if you're interested. But I do want you to know that if you have any questions about this video, you are welcome to leave us a comment in the comment section below. Also, anyone out there who has gone through this process of getting an IBS diagnosis who wants to share their story, we would love to hear from you. So definitely leave a comment if you feel comfortable doing so.
Thanks for watching this video. And as a quick reminder, don't forget to check out ibsprobiotics.org. We're really proud of this research project turned comparison tool that we've made. And of course, it is free and publicly available. And if you want to keep up to date with the latest IBS research, you can follow me here. See you next time.